Today I have as my guest Jan Köhler. Jan is an osteopath. He's going to explain to us a little bit about how he became an osteopath, what is osteopathic therapy, and what sort of problems Jan can help you solve. Jan, welcome.
I was always interested in movement. I started actually out as a dancer, worked several years as a professional dancer. Every dancer probably knows you're going to have an injury from time to time and you're going to have to be able to deal with that. And so I became interested already during my dance career in the physiology of the body and how to work with that. I started finally a study of physiotherapy in the Netherlands. Did then a little bit of a journey, so to say, and I worked in the Netherlands, I worked in Portugal for a while, and then came back to Germany, to Hamburg. As much as physiotherapy was fascinating, there were some aspects that I was missing in my treatment. Some aspects that I was not able to reach or touch with my techniques. Started a 5-year course in osteopathy, and now since 2012 I'm working as an osteopath and since several years in my own office here in Hamburg. There is actually a common basis between physiotherapy and osteopathy in the sense that they're both concerned with movement in the body. And they have the premise that the body is basically designed for movement. In physiotherapy, you usually apply that way of thinking to the movement apparatus in the sense that you look at how the body moves, the joints, the muscles, the capsular ligament system. So in osteopathy, we try to look at all the systems and not only look at them but also determine if somebody comes to us with a problem, which of the system or which connections between systems are most relevant for that person. Sometimes there is a blocked vertebra and you unblock it, but sometimes you have to look really, have to find where are the connections between the different areas, between the different systems, especially if there are injuries that already exist since a longer time. Where the body has made more adaptations to be able to function still. We don't think in separate muscles and separate joints, we think in activities that we want to do, and our brain, our body just takes care that we are able to do these activities. If we really push our body to the limits because it cannot function properly in certain areas, then it's possible that it reacts with pain, telling us usually that there is something that is too much for a certain area. And then the problem can be, of course, in that area, but very often the source can be somewhere else, because the area that is making problems is just the area that has the least can at least compensate for the things that we're asking from our body. The reason people go to seek help usually is some sort of pain or discomfort. Sometimes to find the cause of the problems is very simple, because, for example, if somebody is sitting badly, the muscles shorten, certain muscles tighten because they have to work in position that they don't really like, or that they're not intended to work in. Where you unblock vertebrae is a often very easy way to create better movement. Still, you always have to look as an osteopath, is that really the only cause of the problem? Are there any further adaptations that the body has made? You need to work on the fascial system. Do you need to work some muscles to get somebody to enable somebody to use also that new range of motion that he has gained? Possibly even long connections throughout the body from sometimes problems that we have already long forgotten about, but the body is still trying to compensate for, or has gotten used to the compensation that he adapted.